We're starting the show without music here today. We're having a little problem with our music in the show, so we'll just go straight to the intro, which is Welcome to Living Hope, the one show, the only show that gives people some living hope for those living with pancreatic cancer, with our host, who's been living with hope for how many years now?
23.
23 years. That's amazing.
Yeah, I'm redoing 23.
And today we're going to have you a little more hope. This is a hopeful show here today because you're going to bring in somebody who's going to talk about research. I didn't think there's hardly any research going on. I'm here now. There's a lot of research going on.
Yeah, there's a good amount, and I hope I get this quote correct, but hope comes from progress, and every new discovery brings us closer to a cure. From Kerri Kaplan, who is our guest today, President and CEO of the LUSTGARTEN Foundation. I think it's the world's largest private funder of pancreatic cancer research, but under her leadership, she has been able to drive major breakthroughs, from the first FDA-approved immunotherapy for pancreatic cancer to allow for early detection and personalized treatment. So hopefully she'll tell us a little bit more about that. But she's going to let us know, because a lot of us don't know exactly what LUSTGARTEN is doing, and we're really interested in their research and just who they are. So welcome, Kerri, and thank you for joining us today.
Thank you so much, Roberta. So just, I'm the president of the LUSTGARTEN Foundation. We have a CEO as well, so that's Linda Tantawi. So I just wanted to clear that up. But thank you so much for the wonderful introduction. And Paul, I'm so happy to be able to tell you that so much research is going on, and we've been funding research. LUSTGARTEN has for 27 years now. So
wow, there you go. Because again, when we said this off air, one of the common things we've been doing this for a couple of years is we hear over and over again, why can't there be more research on this? And the assumption is, even from some people we've talked to, it's not enough people have the disease, or the prognosis isn't, people don't live long enough, so why are we going to research this thing and try and come up with drugs or regimens or cures? Not enough people, and maybe it's not worth it. Is that a horrible way to look at this thing? And obviously that's wrong.
I like to say that I have found that the absolute best and the brightest people in research and science have taken on this disease because that's the kind of people they are. You know, yes, I think when the foundation was started 27 years ago and the survival rate was 4% and there was really no federal funding and, you know, things were very grim, you know, why would you want to get into this cancer?
Yeah, right.
But, like our chief scientist tells us, you know, I want to solve hard problems. I want to take on the hardest problems there are. So, you know, I am just grateful that those are the kind of people that have joined us, you know, in this fight for more research and you know, they're just the most brilliant minds. And, you know, we went from really a handful of researchers, you know, doing this when the foundation was founded in 1998 to, you know, thousands. We just, last month there was a big conference for pancreatic cancer research, and over 600 scientists attended to learn, you know, what's the latest in the field and share, you know, and, you know, listen to presentations and give presentations and posters. And, you know, the field has just grown tremendously.
And where was that held at?
That was held in Boston. The organization, the American Association of Cancer Research, hosts an annual meeting. LUSTGARTEN is a large supporter of that meeting. And, you know, just more and more people have been attending, you know, every year. You know, went down a little bit with COVID, but we're starting to get back up to those, you know, pre-COVID amount of attendees.
Yeah, it was a great fact. I was actually supposed to be there, but I had a bout of pancreatitis and couldn't travel. So I was very disappointed because it would have been actually my first year, and I'd been looking forward to going every year. So,
well, Roberta, I think next year is going to be in San Diego.
Oh, that would be wonderful. Yeah, that would be much closer
for you.
Very much so. Yes. So, can you share with us who the LUSTGARTEN Foundation is and what you're doing and how you got the name?
Sure. So, I mean, our mission is to transform pancreatic cancer into a curable disease. And like Paul mentioned, we are the largest private funder of pancreatic cancer research. And, you know, the foundation started 27 years ago in 1998 when Mark LUSTGARTEN was diagnosed with pancreatic cancer. Mark was a senior vice president at Cablevision and the chairman of Madison Square, vice chairman of Madison Square Garden. So for those listening from the East Coast, The local cable network was Cablevision at the time, and the same owners of Cablevision also owned Madison Square Garden and still own the Knicks and the Rangers and Radio City Music Hall. And Mark was, a senior executive there. And when he was diagnosed at, in his early 50s, very little was known about this disease. And at that time, there were no private organizations, doing anything. There was no private funding. And Mark, with the Dolan family, who were the owners of Cablevision and very close to Mark and his family, started the LUSTGARTEN Foundation in 1998, 27 years ago, really to, change that fact that Mark had nowhere to turn. I mean, it took him even a month to get diagnosed. He didn't know where to, how to find doctors, who was doing the latest research. He, with the leadership at LUSTGARTEN, put together, the first conference. I mean, I talked about 600 people there. We were lucky to get, maybe 25 people that were doing, research across the country. And I think that was really LUSTGARTEN's major role from the beginning, which was to stimulate the scientific community by funding research. If there's not enough funding, you're not going to attract people into the field. Paul, we also talked about, are there researchers? Well, now there is a lot of funding. There's more federal funding than ever before, although, in these days we are worried about that. But there's more private organizations as well, and LUSTGARTEN has been really leading that. We have funded more than $300 million in pancreatic cancer research since our inception.
That's a big number, yeah. And any interesting, intriguing things, breakthroughs, or maybe I should back up and say, where is this research happening? All over the country, or are there certain...
All over the country, all over the world. So we fund research all over the world. We have dedicated laboratories at 5 institutions: Cold Spring Harbor Laboratory, Johns Hopkins, Dana-Farber, MIT, and the Salk Institute. But we have projects, we fund some early career researchers to really big multi-million-dollar projects. Our labs get $5 million. We're now in a position over the last few years to fund clinical trials. So we fund earlier stage clinical trials to really do deep science and get proof of concept, so that trials can go further to help patients. We're really focused in a couple of areas: early detection, personalized medicine, and drug development. And I'm really proud and thrilled that really the major breakthroughs that have happened in this disease have happened from funding that LUSTGARTEN has provided over the past 27 years.
Can you talk a little bit about some of these breakthroughs that you have experienced?
Yes, certainly. So, in early detection, which everybody is sort of, one of the reasons why pancreatic cancer is such a deadly disease is, as you mentioned, is because it's not found early. So all cancers that are found late stage are more difficult to treat. And with pancreatic cancer, 85% of patients can't have the surgery, which is really the only cure at this point. So what we've really been pushing on is, how do we find this earlier? Because if you find it at an earlier stage, the survival rate is significantly higher than when you find it at a later stage. So in early detection, where some of the really exciting things are, this whole field of artificial intelligence. So one of the projects is really training the computer to see pancreatic cancer when it's much smaller than right now. A radiologist can see it on a scan. So we've shown that the computer can find tumors at, between 1 and 2 centimeters, which is very small. And, at right now, by the time it's seen on a scan, it's big, and it's already oftentimes too late and metastasized. So we really want to find it when it's very small. So that's been very exciting. Also, we've done some of the AI work shows that you can cull through medical records and really find some triggers in people. For instance, there is a subset of people with diabetes, and certainly not all people with diabetes, but a certain type that go on to have pancreatic cancer. We actually feel that they had pancreatic cancer before they had diabetes, and it caused the diabetes. And so, if people get diabetes and then there's some sudden weight loss, there are triggers like that we're now hoping will be more in the general population, going forward. And just some really exciting things in finding the pancreatic cancer really much earlier and much smaller than we had before. So everybody, has these very small precancers. Apparently most people have precancers and have many of them, and most of them are benign and nothing will ever happen and they'll never progress. But one of the projects we're undertaking is, there are some of these, a handful of these, that do progress. And so how can we identify which ones are bad so we can do something about it when it's really small? And in early detection, another really exciting project, which I never thought, 25 years ago we would be able to do this, but we are now testing a vaccine to prevent pancreatic cancer. So that would be a vaccine for people at high risk, whether it's the genetics or they have these bad cysts that we talked about. And could we stop the cancer from growing before it turns into a cancer?
I just fell off my chair. You can actually vaccine, and so people either have a genetic predisposition or have some little precancers growing, and you can vaccinate them?
Yes. So now everybody should not run out. You can't get this vaccine
Wow,
yet.
yeah.
But it's in a trial. I mean, the FDA has approved it. 25 people went through the first trial. Now we have to, and they showed, good safety. Obviously, the first thing is to show it's safe, because you're not going to vaccine healthy individuals if it's not safe. And now really, and what we've also seen is that it does boost the person's immune system. That's what we're looking for. And now it'll be a matter of really following these people and expanding the trial and seeing, we're not at the stage yet where we really know if it effectively stops pancreatic cancer, but it is out there. People have been vaccinated. They're being followed. This is, not science fiction. This is, down the line, something that we really hope will be a major breakthrough for healthy individuals, because people now, they know they have a family history. They know they have these genes that may cause it. They're not prophylactically taking out their pancreases like they do with breast and ovarian cancer. So, this vaccine, we really hope down the line could be something. We're excited about it, but it's early days.
We just had somebody in from a Hoag Hospital, whatever they call it, translational lab or something like that, where they're doing research, and it was all about genetic research, right?
Yes.
And so the question I posed, or we posed, was, okay, so you've now going to test me genetically because I have one or more family members that had this. Let's see if I got the gene. Doesn't mean I got the gene, but I might have the gene. And then so what? Oh, lucky me, I got the gene. I have a tendency for it. What can you do? And they were kind of like stumbled around. Well, you can change your diet a little bit or something, but wasn't a lot you could do. Just be aware. I guess get it early.
What you should do is go into a surveillance program.
Yeah.
So it is proven that people that are in a surveillance program and they either get MRIs or endoscopic ultrasounds or CAT scans every year, every 6 months. So right now, if you find an early pancreatic cancer, the survival rate of 5 years is about 45%. But they've shown that these people that are in these surveillance programs that find it really early, whether it's stage 1 or maybe even earlier than stage 1, and they take out these worrisome lesions, they actually have a 5-year survival rate of nearly 75%.
Wow.
So really, I do encourage people to see a genetic counselor, talk to, people that run these high-risk clinics, and there are many of them around the country, and you can go on our website, lustgarten.org, and look for the list. You can, people, I know I've heard the same thing that you've heard, Paul, but I say, No, go be in a surveillance program. If you find it early, that's your shot for a cure. I mean, Roberta, you found it early, right?
Right.
So that's 23 years. There we go.
And she fought to find it early because she had how many family members? You always tell me, and I always
Yeah,
forget.
I'd already lost 3 family members to it, and doctors weren't too interested because I was only in my 40s, and they were telling me it wasn't hereditary at that time. I
I think
lost.
things have probably changed over, since you were diagnosed. But you know what? And I know I've heard your podcast, so I know your story. Like you say, keep pushing, keep advocating for yourself. Don't accept that. You know, but you can definitely join a program where you can have some sort of surveillance, and they can be, checking you, every 6 months. And then if you find something really small, they won't leave it in. They'll take it out, and it's not a terrible thing. There's a woman in Texas in 2006. She had lost her mother and her daughter to pancreatic cancer.
Geez.
And so they took out, they ended up taking out her pancreas, which you can do. They don't do it lightly, but you can do. She's diabetic now, but her pancreas was riddled with all of these precancers. And that was 2006. And so now, nearly 20 years later, she's doing great. And she surely would have, one of these things surely would have turned into something more aggressive. And I don't know that, she would still be here 20 years later. So certainly.
And was she on a surveillance program, or did it even exist back then?
I think she was one of those early people on a surveillance program. And I think also because of this, mother-daughter thing, yes, she was at Johns Hopkins, where they're like sort of the pioneer. I mean, she was in Texas, and she went to Johns Hopkins because they're certainly the pioneer in this, and they have have been doing a lot of work in this early screening and familial pancreatic cancer, and they took out her pancreas. Yeah.
Does the doctor have to refer you to the surveillance program, or can you look for it on your own and find one on your own?
You can definitely look for it and find one on your own. You can go on our website. You can look up the CAPS program. CAPS is cancer of the pancreas, cancer, adenocarcinoma, pancreatic screening. There's 5 or 6 centers around the country, and lots of institutions have these high-risk clinics. So, and you can always call the LUSTGARTEN Foundation, and we can help you find that.
And let's spell Lustgarten. Somebody's already tweeting in. So how do we spell Lustgarten again?
LUSTGARTEN, lustgarten.org. And outside of early detection, the thing is also, if the earlier you find it, even if it's stage 2, stage 3, the better the therapies work. And there's so many exciting things happening in therapies that I want to mention. So, right now, everybody, is super excited about these drugs targeting KRAS. That's the gene that's mutated in 90% of people with pancreatic cancer. So maybe 10% have these other familial genes. And if you don't have that, you generally will have a KRAS mutation. And they used to say that they called it undruggable. You couldn't do anything about it. And now all of a sudden there are drugs on the market, and there's lots of clinical trials out there with these drugs that are showing a lot of promise. Now, I will say right now, the drugs alone, people do become resistant to them, which is the problem with pancreatic cancer treatment. But there's so many trials now, adding immunotherapy, adding combinations. I mean, that is such an exciting, hopeful area for people, that there hasn't been a newly approved standard of care since 2013. I mean, there have been some other standard of cares that people do get, but, this looks like we're hoping down the line, this may become the new standard of people to get these drugs that target, their specific mutation.
What was the company we had on a couple of weeks ago that it doesn't have a new drug but has a better way to deliver it?
Yeah, they have a catheter that they use in other drugs, but it's especially with pancreatic cancer. I don't remember the name of the company right now. Thank you.
We'll have to go look at it. It was a couple of episodes ago. It was pretty exciting.
Yeah.
And then the other one, I throw this out because nobody's ever heard of this, and I'm still not understanding it. We're at UCI's, University of California, Irvine's Beale Applied Innovation Center. That's where our studio is. Fancy word for where they try and take technology and turn it into something, which is mostly med tech and medicines here in Orange County. That's what biotech, biomedicine, all the stuff is we're known for here. So they had a conference here with all these universities around the world on this protein called Klotho with a K, Klotho, which is, I guess, a gene protein or something. And they found it years ago, it had something to do with aging. When you have less of it, you're more likely to get Alzheimer's and lose your hair and cancers and all sorts of things. And there were a bunch of people presenting saying that they're experimenting with under FDA programs using somehow stimulating more of this in your body. However, that's the question. How do you do it? And that can help or maybe kill cancer cells, including pancreatic cancer. It seems to be it's the one thing that connects all aging things. As you get older, your body gets less of this. You can get more of it through exercise, but the whole conference was what happens if you increase this protein. Magic things happen. And we had somebody from the University of Pittsburgh talking about recovering from brain injuries, other sorts of things, Parkinson's, dementia, and other things. But the question is, how do you increase it? And that's what they're still not sure. Do you stimulate it? Do you inject it? Do you do gene therapy? What do you do to get more of this in your body? And that's what they can't figure out yet.
I would have to say you brought up a good point. I think the reason there's so much more hope and more breakthroughs is just the technology has improved so significantly.
Yes.
You know, all of these new technology. I mean, I would say so many of the projects that we're funding now we have a new technology. You know, we're funding a project, we want to learn, right now, I think about 80% of the people that have these family histories, and I think, Roberta, you know what gene you have, but they don't understand why they have a family history. Well, now there's new technology for us to uncover, more of these genes.
Right.
And that helps because then in families that have the pancreatic cancer because of a gene, family members that don't have the gene, would be in a different boat than family members that have the gene.
And do you think we asked this to the woman who runs the Hope program here? Will we get to the point, the sci-fi example where they'll tell you got the gene, you inherited this gene, and they'll do gene repair, and they'll go in and fix the gene or replace the gene?
I don't know about that, but
Isn't that what she was talking about at the Hope Hospital?
That would be right. I mean, there are these, the BRCA, it's a DNA, damaging gene. I don't know. That would be unbelievable. I'm not a scientist, so we got to ask the scientists about that. But, listen, there are so many new exciting technologies out there that, that's really what is going to help us propel, that, and obviously research funding. I mean, that's also part of what LustGarten does is raise money to fund all of this research.
And what's the state of that? I'm sorry to keep jumping in here, but that we've heard so much about. Roberta was in a program with the Department of Defense that was cut entirely.
Yeah.
And a lot of this cancer research and funding we're throwing the baby out with the bathwater. Maybe there was government waste, but don't waste everything here. Don't throw it all away.
No, we're very worried about that. I mean, that's where private foundations like LustGarten, are so important because we don't get government funding. So we're not personally, being hit, but certainly a lot of the institutions that we fund, they get supplemental funding from the government for their infrastructure and things like that, will be, look like they're going to be cut. We're definitely, our CEO and our vice president of research was just last month in Washington at one of these rallies and visiting with the, congressmen, and we've been, writing to and lobbying the FDA to help, get these KRAS drugs approved faster. So, that's not our primary focus, but certainly, as an organization that funds research and, talks to patients and has a lot of constituents that, donate to us, we're always looking for, what else do we need to do? And we actually have a whole section on our website if you're interested in, what can I do to help, with this federal funding. We have sort of a checklist of 8 things, how do you contact your congressman, all the different things that you can do. So you can check out our website, which is www.lustgarten, LUSTGARTEN.org, for ways to get more involved, to find if we have a walk in your area, if you want to just make an outright donation. People do their own kind of fundraising. They do everything from golf tournaments to bake sales, millions of different kinds of things. So, that's the other thing that we really promote is, we say community is power, and we have a whole community. I mean, I'm sure you would agree, Roberta. I think this disease is so devastating, but people, you could understand why people would just want to walk away from this if they've lost a family member, but we really find the opposite. People just do not want this to happen to other family members. That's how the Lust Garden started. Mark lived 16 months, but his family said, we don't want this to happen to other families. And Mark's son, Andy, is actually the chairman of the foundation now, and his whole family is involved, and they've sort of taken on this fight for all the other families out there.
Yeah, I've been very surprised because I would think, somebody coming across me who lost somebody, and then finding out that I'm a survivor would not be so, not that they want anything bad to happen to me, obviously, but not to be so supportive. But I've been very surprised and very moved by how many of them will come up to me and hug me and say, I'm so glad that, you're here and that you're doing something. So
we find that exactly.
Yeah.
I mean, our walks, we do have more survivors who come to our walk and they cut the ribbon, but the majority are these people that have lost loved ones, and they just want this sense of community. They want a sense that they're doing something. We always have a mission tent, and we always have a speaker at the program telling them what's happening, giving updates, and they really, crave that information. And again, they don't want this to happen to any other family if they've been through it. And of course, they worry about maybe it happening again in their family because of that, small familial component.
Right. LustGarten often partners, and you are partnering right now with Stand Up to Cancer. Is that correct?
We have lots of partnerships. We've partnered with Stand Up to Cancer. We're still there's one or two projects that we're still funding with them. We partner with Let's Win. Actually, LustGarten helped start Let's Win with our board member. We're part of the World Pancreatic Cancer Coalition, and we're going to be announcing soon we did a major partnership with the American Association of Cancer Research, the Mark Foundation, and a foundation called Breakthrough Cancer. All of us interested in early detection, and there'll be grants announced, some in pancreatic cancer and some in other cancers. But, we were sort of a founding member of this collaboration where, first of all, you can certainly learn things from other cancers and their early detection, but really just trying to go out as deep as we could into the community of all these organizations that are interested in early detection. And so there'll be, really some grants funded for the toughest cancers, including at pancreatic cancer, that we'll be announcing kind of the end of this year.
Oh, that'll be amazing.
We're excited about that.
Yeah. Do you think now these organizations working together, is that going to help speed up progress?
Definitely. I mean, I will say I find that in this cancer, with it being so tough, one of the things that I'm amazed and thrilled about is the collaboration. So I mentioned we have 6 labs across the country. I mean, they get together all the time, whether it's on Zoom or, at our meetings. And, one lab might be doing, some of our labs don't have a clinical component. And if they find, the Salk Institute, found some really interesting research with a vitamin D antagonist. And then, at Dana-Farber, they did the clinical trial for that. Cold Spring Harbor Lab has been the pioneer for these organoids, where you take a piece of someone's tumor and you test drugs against it. And now, Hopkins and Dana-Farber and the other institutes are using the organoids to test drugs and to test the idea of personalized medicine. So there's collaboration in so many ways with organizations and with these laboratories across the country. I think people, I hear it's a worry, are they very siloed? And I'm happy to tell you that that's not the way it is. And that,
because that did seem to be part of the problem years ago. Some of the other people have come and talked about it. Everybody's doing their own thing, and they're very protective because maybe it's going to lead to some, drug or something here. So there wasn't a tendency for universities or for research institutes to share data. There wasn't a common data set.
I mean, when like Roberta, if you go to that meeting next year in San Diego, you'll see it's like it's like the networking sessions are just jammed with people, younger investigators going over to these mentors or these people that we hear about and asking them questions. And I will say the older generation, our chief medical advisor is Dr. Elizabeth Jaffe. And I mean, part of her sort of mantra is the next generation of people. How do I train people? How do I help people? She's just all about, traveling around, giving talks, helping people, letting people come to her lab. We see that over and over again. It's really fabulous.
I had a question somebody asked because we were talking about the vaccine. Is there a blood test on the rise that can, be part of your physical that they can detect?
That's the one that Aggie Hirschberg from the Hirschberg Foundation is always talking about.
So there are, LustGarten did, we did a lot of funding for a blood test, and there are blood tests on the market now. Actually, the one that we funded is called Cancer Guard. It was taken over by a company and commercialized. And now there are some blood tests that are not FDA approved and not covered by insurance, and people can get them. The jury is still out whether pancreatic cancer really will benefit from the blood test. From what I understand, they do pick up early cancers in other cancers, but our researchers are still not convinced that the people shed enough DNA early enough to get into the bloodstream, but we'll see. There's definitely a lot of follow-up on that area. The problem is if when they did the original kind of clinical trials with 10,000 people, in 10,000 people you might expect one pancreatic cancer because it is a little bit rarer. So so then they did 10,000 people, they didn't find a pancreatic cancer, which wasn't to be expected. So I think time will tell. I mean, there's these tests are out there. You can, if you're at high risk, you can talk to your doctor and see if it's appropriate, but we just don't know yet whether or not that is, there's a lot of, I'm encouraged that there's a lot of research and there's a lot of labs looking for these early biomarkers. And that there are these tests, and as more people now get these tests because they're available, we'll see where that goes.
Because you look at what happened to things like prostate cancer, which was equally deadly until now everybody gets screened for it early enough, and you generally can catch it early enough before it metastasizes, before it gets worse. And you're saying the same thing. So, and pancreatic cancer being so elusive, is it my back hurting or is it a cancer growing in there? Is it just,
right?
So you put it off until it's severe and then suddenly it's too late.
Yep, exactly. I mean, the symptoms are kind of, back pain or stomach pain. Those are symptoms of a lot of things that are not pancreatic cancer.
Right.
So, sadly, and even when somebody gets jaundice, which is a more obvious sign, that often means it's already metastasized,
Right.
Unfortunately, as we said, most of the time it is picked up too late. So we're encouraged that there'll be more work done on the blood test. There'll be more work done in the artificial intelligence area. And, we will continue to look for exciting, interesting ideas and put as many, shots on goal as we can. My chief scientist is a big, our chief scientist is a big sports fan, so he's always using the sports metaphors. But, we don't know yet about a blood test, but we'll see. That may be down the line. We'll just have to see.
Well, it sounds like you guys are doing great work, and I really appreciate it.
I'm more hopeful than I've been in 2 years of doing the show or whatever here. Yeah.
Yeah, it was good to have you
Really,
on.
I will say the momentum, I mean, every researcher that we speak to says I've never had so much hope. I really feel like, we are turning a corner and, listen, we started way behind, when all of these organizations, the big organizations in pancreatic cancer started 27 years ago, other organizations were, 50, 60, 70 years old. So we're behind, and we didn't get all of this increased funding until the last, 10, 20 years. So, but we're catching up. And we're doing great work. And Roberta, thank you for being part of our hopeful message and being such a great advocate for Pancreatic Cancer Research and just pancreatic cancer
She's the
support.
storyteller. She collects all this and finds it all somehow and shares the
Yeah, I
stories.
mean, things like this podcast alone, like people just getting so much more information, but I love that it's called, Living with Hope, because that is what we want people to know, that
Yeah.
there is a lot of hope. We're not there yet fully, but it's getting better every
When
day.
she came to me and wanted to propose putting this together, I thought, how long can this last? What it's a pretty bleak landscape. What kind of podcast can we create where it's just negative? There is no hope. And
Right.
so she's consistently found ways to help people and give them
Oh
some
yeah.
hope.
Oh yeah.
Thank you. I think even when our stories don't end the way we want, obviously like with Mark, but something good comes from everything, and we have to look for that and just put that out there, and hopefully people will find that and turn to organizations like yourself to make a donation, and they can go to LUSTGARTEN, LUSTGARTEN.org for donations and to find out more information, maybe events in their area and whatnot. So we really do appreciate all the work that you are doing, and thank you for coming on. I've been wanting to have you guys on for a long time now, just to let people know exactly what you are doing. So we greatly appreciate that. So thank you.
Well, thank you for having me.
As Long as You Speak My Name, I Shall Live Forever is dedicated to Cindy Leff, whose grace, strength, and vibrant spirit shone brightly throughout her battle with pancreatic cancer. Her light and love continue to live on through her family and all who knew her. Thank you.
Well, there you have it. That's one of the more hopeful episodes we've had in a long time of Living Hope, your journey with pancreatic cancer. Maybe the pace is picking up here, and there is hope in the horizon. We hope that you'll share this with somebody and give them some hope today as we continue to share the stories that we collect through this podcast we call Living Hope, your journey with pancreatic cancer. Streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center, I'm Paul Roberts on behalf of the OC Talk Radio Network.